We spend $3 trillion on healthcare, and that's unsustainable.
$3 trillion. That's an unsettling number. Clearly the need for transformation has never been greater. Indeed, Ken Bellian, former Chief of Operations at Denver Health, was just one of many senior executives interviewed at our recent NG Healthcare Summit who was excited about the opportunities ahead in healthcare transformation. But he says there are some significant changes that need to be addressed first.
There's a sense of urgency of doing that. With the lack of insurance for some people still with the Affordable Care Act, how do we make sure people are covered? How do we bear all of those costs? And really, how do we drive a more quality product that's more patient-centered? And so I think trying to communicate that to people and getting them to buy in and understand and eliminating some of the resistance. And I think that resistance is because we haven't really communicated the message effectively.
They say change is good, but what does it really mean for the healthcare system?
I think one of the huge fundamental changes, we're getting disruption from the ground up from others who haven't historically been in healthcare. So payers are thinking differently. Laboratory services who had historically just been providing labs are now acting in decision support. You have entrepreneurs who are working with the consumer to develop products that are interfacing now and disrupting. And so as a large organization, if you aren't willing to think about some of these disruptions and how do you partner with them or how do you think differently, then it's a challenge for the large organization.
Well, what of the future? Where next for healthcare?
It's really a transformative time in healthcare, and I think there's so many opportunities to make meaningful change. And so whether it's on the digital health side, whether it's on the risk sharing side, with providers now sharing risk with payers and hospital systems, whether it's some of the mergers and acquisitions and thinking differently about how we do that, and whether we think about the whole care continuum and actually extending that and starting to do bundled payments. I think it's just a great opportunity right now for someone to be wonderfully successful.